Welcome to a Prevent Connect podcast, where we explore the prevention of violence against women. This is a project of the California Coalition Against Sexual Assault.
Hello, this is David Lee from Prevent Connect, and today I am speaking with Diane Hall, who is the lead behavioral scientist at the Division of Violence Prevention at the Centers for Disease Control and Prevention, and we're going to be talking about the newest version of Veto violence that has just come out. So how are you doing today, Diane?
I'm great. Thanks so much, David.
Well, it's a real pleasure to be able to talk with you about veto violence. I think veto violence is a really important tool for practitioners doing prevention work, and I'm really glad to see that there's a new version out of veto violence. And so I know you've helped develop many of the resources that are featured on veto violence. So let's review what this tool is. So can you just describe what is veto violence?
Sure. Veto Violence is at the Division of Violence Prevention's online training and technical assistance portal, and it's specifically geared for practitioners who are working in the area of violence prevention. Veto's actually an acronym. It's Violence Education Tools Online, and as you said, it's got a new look to it, and we're really excited about it.
Can you just briefly describe what is featured on veto violence?
Sure. We've got content that covers a wide range of topics, so intimate partner violence, sexual violence, teen dating violence, as well as child maltreatment, suicide, and youth violence prevention. We also include some interactive online trainings, such as Principles of Prevention, and we have a training called Dating Matters that is specifically focused on teen dating violence. The audience is supposed to be educators, youth-serving organizations, just folks that are interacting with youth on a regular basis who could benefit from some additional information.
Great. So I'm actually on the website right now and looking at the tools and training section. And in that section, in the tools and training, you can see a whole column listing pieces. And the Dating Matters, which actually you and I had talked about in a previous podcast many years ago, is one of the tools. And then Principles of Prevention, I think, is just a really great primer on understanding public health concepts about prevention. And what are some of the elements of Principles of Prevention?
I like to call it Public Health Prevention 101. As you said, it's got some really important, critical, sort of foundational content. So it covers information about primary prevention. It talks specifically about what we mean when we talk about a public health approach. And we introduce the concept of the social ecological model. What's really critical in public health is that we understand that people exist in these different contexts. So individuals exist within families, which exist within communities, and you really have to take that larger viewpoint to really understand what's going on.
And I think it's an online unit, so people can do an online learning, and I think it's a really great place for new prevention educators or new people trying to learn about why we're using public health concepts in prevention of sexual violence, intimate partner violence, child maltreatment, or suicide, to be able to go through this course and really understand the differences. And I think that it's been of great value. So I really appreciate it as a good starting place for people understanding the public health concepts. Another piece that I'm very excited about, and I know you and I have talked about, is the evaluation. This is a new piece that has coming out. And can you describe what evaluation does?
Sure. So evaluation is also interactive, and it's not really a training or anything like that. It's an interactive tool that helps people better understand what is involved in program evaluation. It's got a section on do's and don'ts. It's got a section on debunking evaluation myths. But the piece that I find most exciting is that there's an interactive logic model builder and an interactive evaluation plan builder. So users can actually go in and answer a series of questions and end up with a logic model and an evaluation plan.
And so I think these are really useful tools and ask really good questions, and it's going to help guide people and help support people. And this is one tool that I'm going to really be talking with people about how to be able to use in their future. So thank you for being able to get this out. We've been looking forward to it. There's many other features you had mentioned in Dating Matters that not only has that education piece for educators and other adults, but also has some other resources that have been developed by the Dating Matters initiative that are available.
So we have a capacity assessment on Veto right now. It's an online assessment that helps people sort of get a handle on what's going on in terms of their capacity and readiness for implementing comprehensive teen dating violence prevention initiatives. And so the user can answer the questions, generate some reports, work with partners, and it's a really helpful tool for people figuring out how to better build capacity in different areas.
And there's so many other tools, and we don't have time, Diane, to talk about all of them, but I really encourage people to go to Veto Violence and check them out. There's a great infographic and some information about ACEs, the Adverse Childhood Experiences, to really talk about how that's useful. There's understanding evidence that we've talked a lot about at Prevent Connect, about looking at different types of evidence, some work around the Strive Online, which talks about youth violence programs that are available, and the PHL, or the Public Health Leadership, has been done a lot around child maltreatment. So these are just many of the great tools. So overall, when we look at Veto Violence, Diane, how should prevention practitioners be able to use this tool?
Well, one of the nice things is that it's a resource that really complements some of the other great resources that are out there. It is available 24 hours a day, 7 days a week, so pretty much whenever practitioners need it. We are currently working to make the site mobile, and so people will be able to access it more easily across different types of devices. One of the exciting things about the new Veto is that it's got an updated look, different navigation, it's streamlined. But one of the exciting features is that you can actually now create a profile and log in. And with some of the resources, such as EvaluAction, if you go into that and create an evaluation plan, logging in allows you to save the evaluation plan. So you can go back to it and edit it. You can download it, share it with others. So it's got a lot more of a personal connection to it. There's also an announcement and events section that we're excited about, so that way we can share news in a more timely fashion with users.
Well, great. Well, I think that's a really great opportunity, and I encourage all of our users to be able to do this. I've been talking with Diane Hall, who is a lead behavioral scientist at the Division of Violence Prevention at the Centers for Disease Control and Prevention. We've been talking about Veto Violence. Veto Violence can be found at vetoviolence.cdc.gov, and I strongly encourage all prevention practitioners to go visit this site, look at the new resources that are available, and help support you in the work that you're doing, in whether it's going to be intimate partner violence prevention, sexual violence prevention, child maltreatment prevention, suicide prevention, or youth violence prevention. These really provide a wonderful foundation of information about the public health approach to being able to prevent all these forms of violence. Thank you for joining me today, Diane.
Thank you so much, David.
Thank you for listening to this Prevent Connect podcast. Prevent Connect is a project of the California Coalition Against Sexual Assault, with funding from the Centers for Disease Control and Prevention. The views presented on Prevent Connect are not necessarily the views of the United States government, the CDC, or CalCASA. To learn more about Prevent Connect, visit www.preventconnect.org. For more information about CalCASA's mission or to show your support, visit calcasa.org. That's CALCASA.org.